In the UK, around 1 in 5 women have their labour induced. It therefore makes sense that we learn about induction of labour in the antenatal period. I'm sure you all know by now that I'm a believer of knowledge being power. And that's because I feel that having honest and evidence-based information allows you to be empowered about your birth choices and feel in control of the twists and turns that may crop up. And this is entirely true of induction. It can be offered for such a range of reasons, and the actual process may also differ depending on your individual circumstance and hospital policy. On this week's episode, I'm joined by a fellow midwife and a midwife as passionate as I am about providing you with accurate and non-biased information. Midwife Louise, known as the Modern Midwife on social media, author, and most importantly, mum to her gorgeous little girl, Georgie Rose, is joining us today to chat about all things induction of labour, how you should navigate your choices, how to prepare for an induction, and what the process may look like for you. Louise has been an NHS midwife almost a decade and has extensive experience in delivering antenatal and postnatal education. She's provided expert advice on BBC Radio 4 Women's Hour, Channel 5 and ITV This Morning. And earlier this year, published a book with Penguin called The Modern Midwife's Guide to Pregnancy, Birth and Beyond. Louise has also recently released an online antenatal and postnatal course designed to support expectant parents from the moment they find out they're pregnant. She runs a social channel on Instagram and Facebook where she provides evidence-based advice on pregnancy, birth and beyond, all of which you can find linked in the episode bio. So welcome, Louise, and thank you so much for taking time to join us on this week's episode.
Thank you so much for having me. How are you?
Yeah, really well, thank you. I know life is crazy busy for everyone at the moment, so I'm really grateful for you giving us some time to chat about this subject that I'm sure you also get loads of questions about from women on social platforms.
Yes, definitely. In fact, I think induction of labour is probably one of the most common questions that I get.
Yeah, totally agree. Now, we spoke about before, Marie, I know we've done some chats about induction, and actually so many more women are induced than we perhaps realise, which can be quite useful when you're going through it yourself.
Yeah, definitely. It is really common in the UK, and it is actually rising as well. And around about 20 to 25%, depending on where you live. And we'll talk a little bit more about that later on, about where you live, because it does really vary. But yeah, the induction of labour rate is quite significant, you know, up to 1 in 4 women. So yeah, 25%. That is a lot of women, and there's probably quite a good chance that if you are pregnant at the moment, that you do know someone that has either been offered an induction of labour or has already had an induction of labour with a previous baby.
Definitely. And I guess from my point of view, Marie, I always think that induction is probably rising because perhaps people are able to get pregnant in the modern world that perhaps years and years ago may not have been able to. And also we are doing loads of amazing work to help reduce the risk of things like stillbirth and poor outcomes for mums and babies. And so that's where sometimes that induction rate can start to creep up. But actually it's worth balancing that, isn't it, with the outcomes that we're looking at improving.
Yeah, exactly that. And that's part of our job, isn't it? Is just constantly risk assessing and saying actually which option is more beneficial to a woman and also to her baby. And that is a constant juggle. And that is one in which, you know, I talk about this all the time about how people view risk differently. And something that I might find really safe, you might be horrified at, and something that I am horrified at, you might find really safe. So it's just about, I think one of our main jobs is for us to be able to relay the information and the facts accurately, and then encourage women to make informed, and their families to make informed decisions about what they would like to do, because then we can remove ourselves, and we've done our job of helping them to balance that risk. But that's the beauty, in a way, that the power is always in the woman's hands. And I always say, you are the birth boss. Like, I'm not here to tell you what to do with your birth. I can help you, give you lots of information and research, but you're the birth boss.
Yeah, that's so important. The control is completely in women's hands, isn't it? Sometimes people explain they felt out of control, but actually it's your body. So if you say, yes, it happens, if you say, no, it doesn't, you are always in control of these decisions. But like you said, it's about having that information, isn't it? And that's the missing loop sometimes.
Yeah, exactly.
Now, there's loads of different reasons, isn't there, why people may be offered or recommended an induction of labour. What are some of the most common reasons that you've kind of come across in your practice?
Yeah, so I think currently the most common reason that women are offered an induction of labour is postdates. So postdates meaning that the pregnancy has gone on for longer than expected. Now, that is also debatable. The length of a pregnancy is debatable. And the way in which we calculate how long a pregnancy should go on for is also debatable. Having said that, the majority of women do go into labour spontaneously before 42 weeks. So we expect a pregnancy to last a maximum of 42 weeks. So that is one of the most common reasons, and that's one that I have seen regularly in my practice. Now, the other reason that is actually on the rise at the moment is reduced fetal movement. So the baby's not moving as much towards the end of pregnancy. So there have been new care pathways, there's been new research. And actually, if I'm really honest, no one is entirely sure what reduced fetal movement really means. Sorry, Pip, can you hear my notifications?
A little bit, yeah.
So I'm using my Mac and I just don't know.
Oh, don't worry.
Sorry. You paused it.
Don't worry, it's not
Oh, I'm sorry. So we'll go back to, I've turned them off, so you shouldn't hear them out. I was just saying about, reduced fetal movement. So with reduced fetal movement, there, in a lot of hospitals, they have decided to put a care pathway in place whereby if a woman reports reduced fetal movement on a number of occasions, and that does vary around different units as well, depending on where you live in the country, but they will perhaps then offer you an induction of labour if you are term, meaning that you're more than 37 weeks pregnant and you've had repeated episodes of reduced fetal movement. The other reason is if your waters have gone and if you don't go into labour. So I think for me, anyway, those are probably the three most common reasons. What about you, Pip?
Yeah, definitely, I agree. They're quite often common reasons that women crop up. And then there's sort of medical complications. So, for example, for women who maybe are gestational diabetic, or there are other concerns in their pregnancies, perhaps they've had some bleeding or they've got a medical condition. And the thing with induction is I always like to think of having like a pair of weighing scales. And on one side, we've got the benefits of keeping your baby in. Yes. And on the other side, we've got that risk of keeping your baby in. And it's constantly weighing that balance, isn't it? What are the benefits and what are the risks? And it's that constant kind of weighing scale balance. And
that's a lovely analogy. I'm going to pinch that one.
Yeah, I love it. I'm quite a visual person. So that for me helps me make these kind of decisions in life, not necessarily just about things like induction, but just in life. And interestingly, a couple of the most common ones we spoke about, so the reduced movement and the going post-dates, the benefit and the risk balance is very much great if we can keep growing your baby and nourishing your baby in the womb, but actually is the placenta perhaps not nourishing your baby quite as well? Might we be better doing that on the outside? And does that mean that perhaps the risk of stillbirth is creeping up? Now, we know that at 42 weeks of pregnancy, that risk of stillbirth or early neonatal death is about 2 to 3 in 1,000 births. So to me, that sounds like quite a small number. To some people, like we said, that might feel like quite a large number. And we know that as pregnancy continues past that risk increases. Now, I don't know about you, but I have heard so many times we state that from 42 to 43 weeks, the risk doubles. Do you hear that all the time?
Oh, I've heard that so many times. Yes.
Oh, and that sounds terrifying, doesn't it? Like, if you carry on your pregnancy, your risk of stillbirth doubles. That's like horrific.
Yeah.
And what we forget is that, yes, it doubles. That is correct. It's 2 times greater. However, the number goes from 2 to 3 in 1,000 to about 4 to 7 in 1,000. So
Yes.
again, that absolute risk might still feel quite small to some women or quite large to others. And it's how we interpret statistics, especially around induction, is so important, isn't it?
Really, really important. And that's the thing, we are talking about very small numbers here. And of course, you know, I don't want to take away from the fact that what we're talking about is very serious, and the risk of neonatal death, you know, it does sound very scary, but we also have to relay specific numbers when we use phrases like double. So double from what? Because actually that's the key part of what a woman needs to know in order to make an informed decision. Because as I mentioned at the beginning, we all view risk so differently. So those numbers might be far too big for one woman, and actually she might be like, oh, that doesn't sound like a lot. Actually, I would prefer to continue on my pregnancy, and that's fine. But yeah, we need to be very specific with the finer details, because that is so important to relay that.
Definitely. And also, everyone's an individual. So it might be that actually in one woman's pregnancy journey, there's some other risk factors or complications that actually mean that is maybe a slightly higher risk than others. And also our priorities are all different, aren't they? So for one woman, it might be that having a water birth is really imperative to her experience. To others, they might be like, well, I'm not too worried. So it's about evaluating all of your wishes and desires and balancing those risks. And that's why just having a good conversation with your obstetrician is so important.
Exactly. And the other note that I just want to make as well on this is that there are always other things to consider. And I suppose this is more of a medical conversation in one way. But the thing is it possible that there is a link between prolonged pregnancy and there being some concern or the baby having some sort of problem that we don't yet know about? Because one of the things I think is important to also look at when we're talking about induction of labour is look at and think about spontaneous labour. So what do we know about spontaneous labour? We know that we believe, anyway, one of the reasons that a woman goes into spontaneous labour is due to the signals that the baby sends off. And it's like this hormonal dance, as I sometimes explain it to women. But the baby is partly responsible for that. So if the baby is not sending off those signals, is there something else going on there as well? Like, you know, is it to do with the baby? Is it to do with the length of the pregnancy? Like, we don't have all of this information. So we only have these statistics to tell you about these numbers, but we don't always have all of the information that we could perhaps know about an unborn baby and about a woman. So I do think that it's important to think of this from an aerial perspective and to look at everything as well, rather than just say, okay, yeah, you know, you're 43 weeks pregnant, there's a big risk that you will have a stillbirth, which is what we hear all the time. You know, what I'm trying to say is it's important to look at the wider picture and to understand what happens between mother and baby. And the other thing is, if we are telling women this information, how is that making them feel? And is that alone preventing the body from doing all of the things that it is also meant to do? So yeah, how we relay things is very important. And yeah, the facts that we tell women, I think they need to be presented well enough so that a woman, it doesn't feel pushed into making a certain decision, and then her body's not given the best opportunity to perform at its best.
Oh, I totally agree. And this comes down to an area that I know we're both really passionate about, and that is women understanding their bodies and the processes of their bodies. And then actually we can always look at induction from a different angle, in that it's trying to encourage our body to continue on that natural physiological pathway. And I think if we can understand that, then we know how to support our bodies in the induction process as well, don't we?
Oh yes, absolutely. And that's something that I often tell women that are feeling a bit disappointed, because induction of labour does get a bad rep.
Yeah.
And I don't think, you know, and I think there's a lot of things that you can do to have a positive induction experience. And yeah, one of those things that I do always talk to women about is understanding spontaneous labour and how to support your natural female physiology, because I think that's really empowering, rather than then feeling like, right, so I'm going for this induction of labour, all of these things are going to be done to me and I'm going to feel pretty helpless, because no one wants that. That's not a nice feeling, and it doesn't have to be like that. When you understand your body, you can, there's various different things that you can say and do and put in your birth plan that supports your body and empowers you to have the best birth possible.
Yeah, that's such a good point, actually. And I think one of the take homes from anyone listening to this, any expectant mums that are being recommended induction or just want to prepare in case, is exactly that, in that it can still be such a positive and empowering experience that you are completely in control of. But having that knowledge and that understanding and asking the right questions, so you know your choices and then making those informed decisions, is so key, isn't it?
Yeah, exactly.
I really like using the brain tool, Marie-Louise, with my women who are trying to make decisions. Is that something you use?
Yes, all the time.
It's brilliant, isn't it? So just to run through that acronym for anyone who's not familiar, it's BRAIN, so BRAIN, and the B is your benefits, the R is your risks, your A is your alternatives, your I is what your intuition is telling you. And oh my goodness, women's intuition is so powerful, isn't it? Especially when it comes to babies and birth.
Definitely.
And then N is nothing, because we've always got the option as well of doing nothing or just watching and waiting and seeing what happens. So that can be a really nice way of asking 5 questions to your obstetrician or your midwife if you're offered something, to make sure you really make a comprehensive, informed choice.
Yeah, exactly. And you can use, that's it, you can use that not just for induction of labour, for absolutely anything. And I actually use it in my daily life sometimes.
Yeah.
Nothing to do with it. I'm like, right, so what's the benefits of this? What are the risks of this? And you run through it, and it is such a helpful tool to have. And then when you can decide what happens. So once you have all of that information, then you can move forward. Whereas sometimes I think when you're pregnant, you are a little bit overwhelmed and you are very vulnerable. And it is a difficult time, especially in these current times. I think a lot of women are feeling more fearful. They are feeling like they've got a lack of control. And this is one way of regaining some level of control and also feeling less vulnerable, because you're able to clearly see, okay, these are the benefits, these are the risks, these are the alternatives. Now I need to listen to my instinct, to my intuition. And actually, it's very really scary. You and I know, Pip, that birth quite often does not look like that. Birth can look very peaceful and very calm, which is why quite often you do have the opportunity to do nothing, because it's not a massive emergency. Even if you're being recommended an induction of labour, it's not an emergency.
Absolutely, yeah, absolutely. That novelty of time really does work for induction, because we know that induction, unfortunately, as we'll go on to, can be a bit of a lengthy process. But what that means is that you've got that time beforehand and during the process to be asking these questions and making sure you understand. Should we just outline what an induction process kind of could look like? Because it is going to be different for every woman. But if we kind of just summarize some of the things and some of the terms that you might hear about to anyone listening, then it might just make it feel a little less intimidating if it crops up.
Yeah, exactly. So the first things first is the induction of labour process does vary, as you've mentioned, around the UK, and the different drugs that I will mention do vary, and the reason for induction varies. So that then, of course, means that the process of induction may well vary. But we'll talk about if, for example, one of the most common reasons, which is if you've gone overdue, generally this is what it can look like in a lot of places. So first of all, if you are 41 weeks plus, depending on where you live, you'll probably be offered a sweep. And that is not normally included in the induction of labour process per se, because it's not seen as a medical intervention. However, I always explain to women that a sweep is still some sort of an intervention, because we're still doing something to your body.
Yeah.
So you will probably be offered a sweep, and you might be able to have a few of those. So that's just where a midwife finds a cervix and tries to stimulate the cervix, and we call it a stretch and sweep. So if we're lucky enough, we might be able to get a finger in to actually stretch that cervix as well. And yeah, the aim of that is to send messages from the cervix to say, ta-da, wake up, we need to go into labor pretty soon. And yeah, so that can be one of the first things that you're offered. Going forward from that, if that doesn't work and you don't go into labor, then the aim is to get your cervix to a place that it reflects the beginning of labor. So during the beginning of labor, your cervix will start to soften, it will start to dilate slightly, and it will start to do all of these various different things to help your body go into labor and for your baby, to pass through the cervix. Now, before labor, the cervix is quite hard, especially if you haven't had a baby before, and a lot of changes need to happen in order for your body to go into labor and continue to progress in labor. And that is the aim of the prostaglandins. So prostaglandins are given vaginally. So they're given in that local area. So that's how I always explain it to women. And they can be given in various different forms. So some places use a gel, some places use a pessary that is like a really tiny tampon that sits just behind the cervix, and it gradually releases hormones. And those hormones are the prostaglandins. So as mentioned, the aim here is to soften your cervix and for it to start to behave like it is in early labor. And then the next step, generally, and sorry, this process can be done on a ward, and you may have a midwife that is looking after you and a few other women. Now, then generally the next process is having your waters broken. So hopefully what's happened is that gel or that pessary has softened your cervix, it's dilated your cervix a little bit, enough for us to be able to break your waters. And that is done generally on labour ward, and you will have one-to-one care with a midwife. Is that that's what's only ever happened in the units that I've worked in? Pip, is that the same with you?
Yeah, absolutely. Once we've kind of broken your waters, we're properly committed to meeting your baby sooner rather than later. So it's so important that women have one-to-one care with a midwife at that stage. Whereas with the prostaglandins, we're not committed so much to meeting your baby imminently, and so that midwife might be caring for a few women, and that's absolutely fine.
Yes, exactly. And the other thing to mention, actually, during the stage of when you have your prostaglandins, you may or may not start contracting. So some women, it works very quickly and they start contracting, and for other women that isn't the case. But either way, you hopefully, and in most cases, will get to a place with the prostaglandins that we will be able to break your waters. So don't worry, if you start contracting, great. If you don't start contracting, great. You know, your body might just need a little bit more time. Both of those are okay. So then you'll have one-to-one care with a midwife, and we'll also be monitoring your baby throughout, So we always keep an eye on babies throughout induction, because it is a form of intervention. So you'll probably be on a CTG monitor, and that just gives us a printout of your baby's heart rate. Some of them are actually all digital now, so nothing prints out of a machine, but we can see it very clearly on a graph, and that gives us an analysis of the baby's heart rate, and it tells us if the baby looks very happy, if it looks like maybe we need to change your position or do something to make the baby a little bit happier, and see if there's anything else that we can do to adapt your environment to make sure that we maintain a normal reading of your baby's heartbeat. Then going forward, we hope that your body goes into labor and starts doing things by itself once the waters have been broken. For some women, that doesn't happen, and we need to move on to the oxytocin, so the synthetic hormone drip. Now that is given into the vein, and we need to monitor you and your baby very closely throughout this process, because it's given into the vein. Although it's given very slowly, and we increase it over every half an hour, and we give it very, very gradually. So it's not like we suddenly give you this massive hormone drip and give you this big dose and all of a sudden you're going to be experiencing these really strong contractions. Although for some women it works very quickly, a lot of the time it is still a gradual process that we slowly increase, and we monitor you and your baby throughout. So if there's a time where you're like, hang on a minute, I'm really uncomfortable with this, you just chat to your midwife about it. We can talk about pain relief, what we need to do to accommodate you to have a positive experience. And then after that, we hope that the induction of labour will progress and that you will have nice, regular, strong contractions, and get to a place where you are able to have a vaginal birth.
Absolutely. And actually, just by understanding, I think, some of those processes, it makes it sound a bit less scary, and that actually these things are just encouraging what your body would do. So your prostaglandins are your early labour. Having your waters broken, well, our waters go spontaneously, so it's just mimicking that. And then the oxytocin infusion is mimicking our body's natural oxytocin buildup. So it literally is trying to kind of copy what our bodies might have done anyway. It's not something that we need to be really scared about. And also it means that when we prepare for a induction of labour process, actually it's the same as when you were preparing for a spontaneous labour process. So all those things you may have wanted to do and have can absolutely copy across.
Yes, exactly. And I think that's it. When exactly like you said, when you explain these things and how we are just trying to mimic what your body does naturally, it's not like we're doing these weird, wild and, crazy things to your body that, yeah, yeah, exactly. I think that is helpful, and understanding the process is absolutely key, because then you can participate in the decision making.
Yeah, 100%. I couldn't agree more. The other thing I'll just mention is that for some hospitals or for some women, we're doing more and more balloon catheter inductions.
Yeah.
And these are essentially, instead of a hormonal method of induction, it's a mechanical method. So we insert a little tube, usually made from some form of plastic, into the cervix and then inflate a balloon. I'm doing like things with my hands if you can see. You can't, but it's so much easier to explain with your hands. And we essentially inflate a balloon of sterile water that sits on top of your cervix, putting pressure to mechanically open it rather than a hormonal method. And for some women, that's just thought to be a safer method. For example, if you've had a previous cesarean section, or actually if the prostaglandins aren't successful opening your cervix, it's another option. It's another stepping stone to helping you achieve a vaginal birth if that is what you wish. And it's just another great tool. So it's something that might also be worth having a chat with your obstetrician about if you think you prefer the sound of that option.
Yeah, exactly. And it is becoming more and more popular now. And I think for some women, it works fantastically. And for other women, it doesn't work as well as the hormonal. It just depends on where your body is at and what is happening. But it's definitely a conversation and something to ask your obstetrician. Exactly.
Yeah, definitely. So we've hopefully reassured people that an induction process is just us trying to encourage that normal physiological process for a woman's body. So how can we prepare for a positive induction? Because when you go into spontaneous labour, you don't have a few days sat on the ward waiting for things to happen. And sometimes an induction can feel a little bit like a lot of waiting around, and it can feel for some women quite lengthy. So what would be your kind of recommendations to make that a positive experience?
Yeah, so I think understanding what happens to your body naturally is a great place to start, because that we are working with your body. So when we understand your body, and when you understand your body most importantly, you are then able to work with it to the best of your ability. So understanding how oxytocin works in your body and understanding how you need to feel to support your natural female physiology and all of that hormonal cocktail and that dance that happens. What can you do to get to a place where you're supporting your body? Now, very, very briefly, I won't go into great detail because we're not necessarily here to talk all about spontaneous labour, but very briefly, oxytocin is the main hormone that's responsible for labour. And that's why we use that towards the end of an induction process and the synthetic hormonal drip. Now, in order for your body to release this, you need to feel really calm, relaxed, comfortable, confident, and you're not going to feel all of those things throughout your labor. I certainly didn't feel all of those things throughout my labor. That's fine. But in order for your body to start producing it and to maintain it, it's okay to have patches where you have little moments where you worry, you know, can I do this? What's going on? But overall, we want you to be in a calm and relaxed state. And we want to facilitate your body to release oxytocin. Now, that might look like to you having an eye mask on and blocking everyone else out and listening to hypnobirthing tracks. Or to you, it might look like having all the lights on, having a bit of some dance tracks on, you know, and I've actually seen women do this, have dance music on and having a little dance in their behind their bay, and they're going for it. That's fine. You know, I think I love hypnobirthing. I'm a qualified hypnobirthing teacher, but I don't think that you have to use a certain method to get the birth you want. I think it's very individual. So yeah, making sure that you look at what can I do that makes me feel calm, confident, and relaxed. That's a great place to start with positivity. The other thing is making sure that you fully understand your options. And I know that Pip and I have just gone over this and over this and over this, but it's because it's so important.
Absolutely.
In order for you to have a positive, we now know that birth experience is actually less about what happens and the length of labor and even how painful labor is. What we know is that positive birth experience relates to women being in control, and you can only be in control if you understand your options. So ask questions, ask as many questions as you can possibly think of, and no question is ever a silly question. You know, like I've met women that are, for example, lawyers or even engineers. I wouldn't have a clue if you put me in a court of law and expected me to know what was going on, or if you put me in some sort of engineering job. You know, I don't know what's underneath the bonnet of my car. We don't expect you to know and to have all of the answers. And sometimes I think women worry that they will come across as not understanding how to parent their baby because they don't know their options already surrounding birth. It's not a reflection on your ability to be a mother, the fact that you don't know what drugs we use during your labor. It's okay to ask as many questions as you need to ask in order to get to a place where you feel confident that you can call the shots. And you don't even necessarily, like, you know, you can just know we use prostaglandins. You don't have to know the ins and outs of every single little thing. And you know, even study it. You just need to know what is available to you, what those things do to your body, and your options going forward from there. And I think bringing stuff in, you know, if you are planning on having a low risk birth and then you're being advised to have an induction of labour, or if you've had a medicalised pregnancy and it doesn't matter, bring something from home in with you. So even if that is your own pillowcase, it's very easy to transport, you know, and it might just make you feel a bit more at home. We are primal creatures, really, and especially when we're birthing our babies. So smelling your own pillowcase, I know it sounds like a weird thing, but honestly, it does make a difference. And we know, I can never say this word, I think it's olfactory. It's in your nose, but anyway, it's highly sensitive, which is why whenever anyone sprays Charlie Red in Superdrug, I'm 14 years old again in the PE changing room. But there's such a strong link between experiences and smells. Now, I don't know about you, but one of my favorite places in the world is lying on my pillowcase. So bringing in something that reminds you of feeling calm and feeling relaxed, whether that be your pillowcase, whether that be a bit of lavender oil, sage, I don't know, whatever that is, but bringing something in that makes you feel calm and relaxed can really help you to have a positive experience, because we need to change that dynamic of you coming into hospital and having to hand over your power. Actually, you're bringing in a little bit of home with you, you're asking all the questions that you need to, and you're calling the shots and making the decision.
100%. I love that. And we're just there to support that process, really. So if you feel good having, like you say, your own scent, and let's be honest, hospitals don't smell incredible. They don't smell very warm and welcoming. So actually adapting that is a really, really powerful thing that you can do. It's whether you're in your own room or a little bay space, that space is yours. That's your little mini home for that period of time that you're there. So you do what on earth you like with that. you put your fairy lights up if that's what you want, you have your headphones in and play your music or your podcast or whatever, listen to the radio. You do whatever you want to do with that space. It's yours to own.
That's it. That's what I always explain to women when I show them like their bed space. I say, this is your bed space. This isn't my bed space. This is your area. Like, I just work here, but you know, here's your next like home from home. And I think it's really important that we relay that to women, that you're not coming into our territory and we're doing things to you, because that is sometimes how it can feel. There is no one owns this territory. When you go into that bed space is yours, and we're not going to judge you if you want to put up your fairy lights, or if you want to have your positive affirmations, or you know, if you want to strip down to your undies and dance around to Fatboy Slim. I don't care, and most midwives do not care, as long as you're happy.
Yeah, absolutely. And it's touching into our senses, isn't it? Thinking about all your senses and what makes you feel comfortable. You can always go through them, you know, what do you want to see, what do you want to smell, what do you want to touch, what do you want to taste, what do you want to hear, and just touching into all of those and creating that positive atmosphere, just like you would for a spontaneous labour environment. You're just recreating that. And I guess one of the benefits of an induction is you can plan it. You know, you've got a date and a time and you know the location, so you can literally plan for it.
That's it, exactly. And that can be quite reassuring in some ways to some women, that they like having that date and that time. I mean, I have to caveat it with that can change depending on how busy the unit is. But, you know, most of the time we accommodate, if we've given you a time and a date, it is going forward from there. One other thing that I always recommend that women have or request if their hospital has one is a birthing ball. Like, these things are just so brilliant. They help you to maintain your mobility. They help take pressure off of your lower back. A piece of research showed an association between a reduction in cesarean section and use of a birthing ball. I mean, it's a link, so it's not direct proof. However, it's worth noting. You can also be monitored on a birthing ball as well, because we do need to monitor your baby, as mentioned, throughout the process. So if you have a birthing ball, it gives you the opportunity to get out of the bed as well. And if you don't feel like standing, you've got something really comfortable to sit on.
Definitely. I do believe that beds are for sleeping in. I don't know about you, but during your induction process, unless you are asleep, you really want to be upright and active and mobile and hydrated and nourished, because that's going to help your labour to progress, and also your baby to get in a really good position, which is essential for labour and birth to hopefully go as smoothly as possible. So definitely lots of things to plan for when it comes to birth, and also induced birth.
Yeah, exactly.
Now, Marie, anyone that comes on my podcast, I always ask for 3 top tips. So sorry to throw you on the spot a little bit, but you haven't escaped. So
okay. No worries. Yeah.
Although I think as midwives, it's hard to narrow things down to 3 when we're really passionate. But could you give us your 3 tips to an expectant mum listening to us today who has been offered an induction and perhaps isn't sure what to do or how to plan for that?
Yeah, so I think the top number 1 thing that has been the running theme throughout this podcast is understand the process. So understand what may happen and when that may happen and what your options are. So what might happen? What type of methods are your care providers suggesting that you are induced via? Is it prostaglandins? Okay, in that time, are you able to have someone with you or not? What type of monitoring do they offer? Going forward from that, if you can't have someone with you, when can your birth partner come? Because when you're in hospital and you're going through all of the, you're about to meet your baby, like this is absolutely huge. You need to have already thought about what leading up to that event of you meeting your baby. You need to understand the care pathway, and you need to understand what's going to happen, because otherwise it can be quite daunting and you're like, hang on a minute, I didn't realize that my waters were going to be broken, so soon. I actually thought that we had a little bit more time, and you want to fully understand the recommendations of that hospital.
Definitely.
So nothing's ever a surprise. And then also the other thing is, I would say, make sure that you work with your body, because as mentioned, this is what we are trying to do. We're always working with your body. So when you too work with your body and you do feel as calm as you possibly can, that makes such a big difference. And remembering as well that you are your body and your baby's expert. We can only tell you a certain amount of things about yourself. So, you know, if you're having and you're told about your induction of labour process, and you're told, oh, it might take however long to start working, and then 20 minutes later you're in pain, you know that you're in pain. So don't necessarily listen to us when we're like, okay, it's probably going to take a few hours. You're what's happening to you is what's happening to you. So, you know, you may be given various different bits of information. We are all unique, and we can only go by what the research says and now experience as midwives. But you may have a slightly different experience, and that is okay. Just talk to us about it, and remember that you are the birth boss.
I love that, birth boss. It's brilliant.
Yeah, I think I've been saying it for a while to women, but I just think it's really good at hammering home that you just call the shots all the time. And I can't emphasize that enough, because as mentioned, one of the most important things for women to have a positive birth experience is for them to be in control. So just, you know, giving that power all the time, just own it. And when you feel like you can't own it, because also that's fine, ask away, ask those questions. So sorry, that was probably about 4, maybe 5, but
we knew that would happen. That's the trouble when you're passionate about something. But no, that's brilliant.
Yeah.
And I really hope that our chat today has just helped to reassure some mums out there who are perhaps anxious about the prospect of an induction, actually realise that they don't need to be, and there's loads that we can do, and it will still be a really positive, empowering experience for their birth.
Yes, yeah, exactly. Thank you so much for having me.
Thank you so much. It's been lovely to chat. We'll speak soon.
Speak soon. Thank you.
Bye.